Hello. So I am waiting on a couple of folks and we'll be right back. Hey,
Ah,
how you doing?
I'm doing. How you doing?
I'm okay.
That's
I
good enough.
was, huh?
I said that's good enough.
I was just over here trying to see if there were any messages. So I told you Rick is not feeling well and is not going to be with us tonight. But I just got a call a little while ago from my ex-sister-in-law, Cheryl.
Yes.
And she said she wanted to join us tonight. So I said, well, that'll be good because Rick won't be there. So, the more the merrier.
That's what I'm saying.
So I added her to the private group and I don't see, I can't tell that she has joined yet. Let me just check one more thing.
I was just thinking about Gio. You should have invited Gio to the last meeting.
I should have.
And I thought about that. As much as she enjoys this type, thing, I'm like, oh, this has been good for Gio. Give her last thoughts. Yeah.
Right. Oh. Yeah, no, I didn't. So yeah, okay. So it looks like Cheryl didn't join the private group yet. So maybe she's having some kind of issue. So I don't want to hold this up.
Yes, let's get started so we can get finished.
Get finished with this book. So let me say, I am Logan Michelle Odom, located in Brooklyn, New York, and happy to be here for our final discussion on The Coming Plague, A World Out of Balance by Laurie Garrett. Seems like we have been on this book forever and ever. So, well, we've learned a lot, right?
Yes, we have. We've learned a lot.
Yeah.
And my name is Venita Walker, and I am so excited to be here and finish up our last chapter of The Common Plague. It has been a wonderful experience. We've learned so many things that we didn't know, but it's time to wrap it up.
Yes, it is.
How many pages were here? All 600 some odd pages were for a wrap up.
Yeah.
Thank you, Laura. Thank you, Laurie Garrett.
And when you think about, for all of the various viruses and bacteria and whatnot we learned about, because it seemed like she felt like she had to cover every one, but she really just scratched the surface. There's just so much stuff out there.
Well, these are the ones that we know of. And thanks to Laurie, we know so much more and so many more viruses, names of viruses than we knew before. So just imagine the ones we don't know about. Thank you, Laurie. I mean,
like we have enough to be scared about.
That's what I'm saying. We already have enough to be afraid about. And there's how many of them out there that we have never heard of? Actually, some that are happening and forming as we speak.
Yeah.
So thank you, Laurie, again.
Thank you, Laurie. So people can learn more about this book group, Reading for Change, A Collective Journey. There is a Facebook page by that name and a YouTube channel by that name. And so all of our discussions related to this book, you can find videos on the YouTube channel. And again, I'm sorry we don't have our third co-host, Rick Terry, with us tonight. Rick has been a wonderful fount of knowledge and he's such a joy. He's such a pleasure.
Oh, it's just too many. It's just too many. It's so hard to describe him. He's just wonderful in every way. He brought so much joy to us while we read about. I miss him this evening. Yes, I miss him this evening. I really do. But I'm looking forward to our next book circle with Rick.
Yeah, absolutely. So tonight, we are going to just spend a few minutes talking about the last chapter of the book, chapter 17, Searching for Solutions, Preparedness, Surveillance, and the New Understanding, as well as the Afterword. And then we get to officially close our discussion on this book and talk a little bit about the next book. So why don't we go ahead? I will read the summary. Let me see if I can share my screen on this. Where is it? Share screen. Monkeys. And, okay. 1989 War Games exercise by scientists and an Ebola outbreak among monkeys in Reston, Virginia, demonstrate humanity's lack of preparedness for detecting emerging infectious diseases and preventing pandemics. This final chapter considers approaches to improving preparedness and asks human beings to think more deeply about our relationship with the microbial world and behavioral changes needed to increase the chances of survival for our species. Chapter 17, Searching for Solutions, Preparedness, Surveillance, and the New Understanding of the Coming Plague, Newly Emerging Diseases in a World Out of Balance by Laurie Garrett, focuses the reader's attention on the issue of humanity's preparedness in detecting emerging diseases and stopping them before they become large-scale pandemics, A 1989 Ebola outbreak in research monkeys in Reston, Virginia, reveals a worldwide path of human exposure. It's New York State against the CDC and leads to improved animal handling guidelines. Scientists also consider approaches to achieving worldwide disease preparedness, focusing first upon large-scale ideals of global cooperation. D.A. Henderson envisioned the CDC in the lead of a global disease monitoring system, but there were severe deficiencies in the agency's capacity to play this role, as well as nationalist and cultural boundaries, making such a plan unlikely to succeed. On an international level, many countries lacked basic infrastructure to detect, track, and stop infectious disease. State and local governments in the United States also had severely limited disease monitoring capacities. Though practitioners of the hard sciences tended to look down upon behavioral scientists, it was becoming increasingly clear that without changes in human behavior, the knowledge and plans of the natural scientists would not and could not be effectively utilized. Scientists were frustrated, and many of the disease cowboys would retire without a new stream of people with their broad range of skills lined up to take their place. While global solutions were elusive, more narrow strategies offered some hope. Satellite communication systems, genetic databases, and Joe McCormick's retirement work in Pakistan to train people in poor countries to conduct their own microbial search and destroy missions. Garrett leaves us to ponder our relationship to the ubiquitous microbes and to grasp the message that either we learn to live more rationally with these powerful creatures or we brace ourselves for the coming plague. In the Afterword, Ron McKenzie and Carl Johnson were greeted joyfully on a visit to Bolivia during their retirement. 30 years later, the locals remembered the diseased cowboys who stopped their plague and honored them with festive celebrations. So I highlighted, I think, 4 questions to kind of get us started. So you want to read number 4, Venita?
Number 4?
Yeah.
4. Let me find it. Oh, okay. Number 4, when Laurie Garrett was writing in the 1990s, it was clear to the careful observer that the world was not prepared to stop outbreaks of deadly infectious diseases before they became global threats. For example, during 1989 War Games exercised by American Society for Tropical Medicine and Hygiene, scientists realized there were no prepackaged infectious disease hospitals anywhere in the United States or at WHO in Geneva that were ready at a moment's notice to be airlifted into an epidemic. Virtually no civilian hospital in the United States were equipped to handle a highly contagious, lethal microbe, either in patients or inside laboratories. Consider the state of affairs today. You still number 4? Oh, that's one of your triple questions in one, okay. I'm sorry. You were on the roll. Yes. Consider the state of affairs. Since 2017, Pandemic prevention research and emergency response structures have been underfunded, sidelined, or removed. This includes an almost 2-year absence of leadership. Only 2 years? Okay. Absence of leadership at the White House Office of Science and Technology Policy. Cuts to pandemic preparedness, staff and funding at the NIH and the USAID, and removal of the global health security team responsible for pandemic strategy within the National Security Council. Domestic capacity to manufacture personal protective equipment, also known as PPE, had dwindled in the US, and as a result of lack of federal contracting and an emphasis on biodefense therapeutics, our PPE and clinical care equipment, such as ventilators, and was in the strategic national stockpile. The dominance of the international supply chain for active pharmaceutical ingredients for drugs was underestimated, and warning signs were ignored. Number one, A, Governor Cuomo apparently sent COVID-19 patients to ill-prepared nursing homes in New York instead of leaving them in the state's hospitals. What do you think about this call? Do you imagine the hospitals were more prepared to handle contagious patients than the nursing homes were? B, after the lack of preparedness the USA showed in tackling COVID-19 in 2020, are you confident these deficiencies, i.e. PPE, have been or are being corrected? What evidence do you have for your opinion?
Thank you.
Oh, thank you for the triple question. Within a question.
Well, I guess on the Cuomo piece of it, I think he had a really hard call there. I would have thought, before I read this chapter, I would have assumed that hospitals would be in better shape to handle highly contagious patients than nursing homes would. But having read this chapter, I mean, this book, of course, was written in the mid-90s. Things could have been done between then and 2020, to get hospitals more prepared. But I don't know, maybe he was between a rock and a hard place.
I agree with you. I put myself in that position. If I were a governor and a pandemic broke out in the United States of America, and we have not seen any in our lifetime, period. And he certainly hasn't been around long enough either. Automatically, my assumption, without having any further knowledge, and most of us don't sit around and read about pandemics all the time in 1985 and 1992. We don't do that.
Right.
And neither does he. Your
Right.
assumption would be the safest, most prepared place to deal with any kind of major anything will be a hospital. They have medications on hand. They have the skill set. They have respirators. They have the hospitals, you would assume, would have everything. Nursing homes don't have that. Nursing homes don't have medication. They don't have trained staff. The staff is not trained to deal with that. They don't have respirators. They don't have anything. They don't have doctors on staff per se that specialize in geriatric medicine. That is a specialty itself. And they have one that's subcontracted that pops in and out. They don't have nurses per se that's trained in the area of geriatric nursing. It is a specialty. So I personally think that Governor Cuomo in an emergency situation with no guidance from anybody, just a few prayers and common sense. That's all he had.
Right.
You couldn't depend on the CDC. You couldn't depend on all the administrations that were put in place for us to be able to depend on.
Right.
Up in the White House, you had, what's his name? I can't call the name because I'm having a good day. You had him up there,
The super spreader.
Thank you. So, I mean, if people, want to come down on Governor Cuomo for his decision, I wonder what your decision would have been on a national, worldwide emergency that hit you all of a sudden from nowhere. One day we was walking down the street having a beautiful day in the neighborhood. I was saying, well, Michelle, I'm going to drive one down there, girl. And, for a day or something. And the next day we all shut down, can't go outside. And I'm not going to the grocery store anymore. They will never eat here again. There's no food in here.
After the Colorado situation.
Oh, yeah, that's it. I'm gonna be one of them Amazon people or something because that's just the way it is. So, but you can't. I definitely not hold them responsible. And people, and I think he's an easy target. I think he's a very easy target. He is not the chief of this country. You want to throw some blame on somebody and say they should have known? Well, if I'm not mistaken, I don't know what the documents entailed. We will never know because that person in the White House that used to be there didn't see fit to read documents that were important, like preparedness for a pandemic that Barack Obama, again, I don't know what was in the documents. But what I do know is they were left behind. What I do know that Barack Obama was smart to know what he didn't know. He was smart enough to take the advice of people that did know. And the scientists warned them. They said, Barack, about that time, we don't know when, the day or the hour, because we're not Jesus or the Messiah, but it's coming. And Barack, because he's an intelligent man, and that's what intelligent people do, he said, what? They said, yep. He said, all right, okay, so I'm gonna put this in place, that in place. You tell me what you need, where to go where, and let's get something together. Because he's an intelligent man.
Right.
So it's not like there wasn't something there. Again, I don't know what was in the documents, but going on having an intelligent president, and he was, and a reasonable one that had common sense, I assume there was probably going to be something there that would have been helpful to us. This is my assumption.
Right.
So, if some people want to start shaking around the blame, don't go to Como. Before you get down to him, you got, I don't know how many people ahead of Como. He did what he could do.
Yeah, he's low-hanging fruit. And, and also, I would assume that hospitals would be better prepared than nursing homes.
My assumption.
To deal with a highly contagious disease. But if they weren't, then you might argue that you're going to have a higher death toll if you leave the contagious patients in the hospital than you would have putting them in nursing homes.
Yes, and then would be the people, because it's never a person, along with the politics, which happens to inundate each and everything you do, right down to when you breathe, or when you breathe. Who would have been those people to make that call? Was Governor Cuomo, was in the midst of everything that's going on, supposed to also be making that call individually with a nursing home, still not the professional, not a medical professional, saying, well, you know what? This is not working. We need to move them to maybe a building over here and send professionals over there to that building. Who was supposed to make that call? Certainly not him. Who was supposed to inform him of the information? Where was he supposed to get it from, out the sky?
Right.
So let's go back to the hospital.
Yeah.
Once they did start receiving the elderly patients there that had underlying illnesses, and even without that, just no immune system because they're 90, they're 85 years old.
And the hospitals were clearly overwhelmed.
It was overwhelmed. The whole system was overwhelmed. They were overwhelmed. The doctors sitting up there saying, well, we're supposed to be prepared. And I wish we were prepared. And we know how to be prepared if we had the tools that we need to be prepared.
Right.
So the doctor was like, I'm ready to go. Everybody was ready to go. Oh, snap. We don't have a mask for our face. Oh, snap. We got to use garbage bags to wrap around our body. Oh, snap. We don't have enough respirators. And guess what? They had never had this experience of pandemic. And what I was reading an article with this one physician, he said he started to panic when he saw that no one was coming off the respirator. Respirators are usually temporary means to help support your breathing because your lungs can't do it on its own while they're clearing up some stuff, whether it's pneumonia, asthma. That's when the doctor said he got concerned. He said, I got concerned and almost downright panicked when I saw that people were not coming off. And then we have more people.
Let's not forget that Cuomo, the super spreader, set the states up to compete with each other to get supplies.
Because this is how you get his freak off. It's like, really, it's an adrenaline. No, the reason why I'm saying that is because looking at it from a narcissistic knowing and having had personal experience with narcissists, I can't say, I can't say that I don't specialize in that field. And I don't have a PhD or MD, but just from personal experience, narcissists, it's an adrenaline drive for them. It's chaos. It's chaos. Oh my God, let me see. I'm gonna pretend I'm at the Mashantucket Pequot Indian Reservation. I'm gonna have everybody putting their bets on this and meanwhile, so I don't, the whole thing was this, to be honest with you, I think also too that the governors could have thought more clearly if that's what they could stay focused on. But they couldn't even stay focused on thinking about what they need to do because you had all this stuff that's beating you in the head. I mean, I give Cuomo credit or any governor. That might be the time I gave my resignation. Say, I'll tell y'all what, I think it's time. This is a good time for me to retire.
Right.
I'm not trying to
It was a total disaster.
It was a total disaster. So, I can't blame it on, I know if it was me personally, I need the tools. If I have a know-how and I don't have the tools, the knowledge means nothing. And that's what they all were up against. They were learning on the fly because remember, our great scientists didn't even know how this was moving. They had no idea how it was moving. We know that it's a respiratory illness. We don't know how fast it spreads up to now. We don't know how it spreads up to now. Remember one time you wasn't touching nothing.
Right.
I mean, literally, I wouldn't touch a bottle of water that I just bought out the store. I would bring it home and make sure I had my gloves on before I washed it. Because they were not sure. So how do you expect him to know when the scientists don't even know, or how do you expect the doctors to know how to treat something other than knowing that it is a pandemic when they don't even know what they're dealing with because it's invisible and they don't know how it's going to react. They have not been here. Remember, nobody's 100 years old that's in the medical, in the hospital.
And in terms of Part B, about whether or not these things are being corrected, I hope they are. I mean, I think that Biden is sincere. I was disturbed a few minutes ago to read a comment by one of my Facebook friends. I didn't see Biden's press conference today, but my friend was saying that all of the reporters, nobody asked Joe a question about the pandemic.
They didn't.
They didn't ask him a question about the Mars rover. They asked him if the trip was fake news. They asked him about the crises at the border. So
and they asked him about the presidency. They asked him over and over, was he going to run for president again? and he was like, man, and you know how he talked. Biden was like, man, I, I'm not thinking about back there, down there, wherever you are. I'm thinking about right here, what I'm doing today, trying to make sure that I get this information out. This is what I came here to talk. And again, they kept trying to bring it back. And again, he's like,
yeah.
No, and that's the part I caught. And he was actually, I could see him getting a little frustrated because his eyes get big when he get frustrated. He started looking at you kind of like crazy.
Mm-hmm.
Because that's not what he came there for. So when the last person asked him, he kept bringing it back. He just put his head down because the notes was in front of him, and just kept talking about what he was talking about. Because that's the only thing that they want to get. They miss the other person who's been in the White House. They really do.
Yeah.
They want to keep that gossip going. But anyway, I hope.
But I think despite all the madness, Joe Biden is doing his best, is trying really hard to put all the right pieces in place.
Yeah.
To try to save Americans despite ourselves.
Right.
So the American Rescue Plan does include, a good chunk of money for PPE, as well as other aspects of preparedness. So, so it looks to me like what happened is from the time that Laurie Garrett wrote this book in the mid-90s, up until 2016, some things were being done to try to prepare the country for a plague.
Right.
And then the super spreader came along, effed it all up, and now we're back to square one. And Joe Biden is trying to rebuild and build back better.
Well, one of the questions that was posed to him today, which is also irrelevant to what he was trying to discuss, was why would he assign? Now, I'm not the brightest bulb in the room, but I'm certainly not the dimmest one. Why would you assign? You know what I'm saying? Why would you assign Kamala to such an important project as to the border and all the things that are going on with the immigrants? And I'm sitting there and I'm saying to myself, am I having an out-of-body experience? Have I totally lost my mind? Why wouldn't he? First of all, he's the president. He has a capable vice president. She reads, writes, and does arithmetic very well. It's called delegation.
She's from a border state. She's the child of immigrants. She's got gobs of managerial experience.
Even without that, if I was the vice president, I would figure it out with the quickness. You know why? Because I know, as most intelligent people know, what I don't know. So even if he did assign it to me and I wasn't a child of an immigrant, which doesn't necessarily make you qualified, or if I didn't live near the border, work with so-and-so, because there's so many things going, so many variables, she is smart enough, an intelligent woman, to know what she don't know, and she will find the people to provide her with the information that she needs to get the job done. Sit down, please.
But it's all gaslighting.
It is gaslighting.
And we have to try not to let it get us too twisted, because that's what it is. It's gaslighting. I
don't get twisted at all.
And there's always been a flow of immigrants, of refugees from the South to this country, and a lot of it has to do with the way U.S. policies have played out in South and Central America. So you create a problem.
Was that typical?
And then people come here looking for some relief from the problems that you created.
Puerto Rico's a good example of that. Puerto Rico is a perfect example. Just one among thousands, but the perfect example that everyone can relate to. Puerto Rico. What the United States has done and taken from you, and then turn around and say, we should sell you. That's a good example. You no. We allow you to come here. You can come here freely while we take all your stuff. While we claim all the wealth and claim your beaches and your beautiful mountainsides and build our metropolis there, but you ain't gonna be no citizen up in here. All right. Right. Okay. You're not gonna get those kind of benefits. Or you can get a couple of benefits from our social programs. That's all. We're taking everything that you have. Right. That's what is happening over and over again. Absolutely. You know, and not just that, all of a sudden it's an influx. There's always been an influx. And yes, there's a lot more than usual because of the situations that you're helping to create, as we know, or you did create. But there was an influx of Europeans. Right. Big influx. They weren't documented. Thousands were not documented. There's some here today that ain't documented. But see, you know, and that's another thing. That's where the racism comes in. Okay, now it's a gigantic, gigantic problem. Okay, but there wasn't no problem before, and we still have some here today that's not documented. Thousands that's not documented to come here. And that's the gaslighting. That's the gaslighting. Keep us distracted from nothing. All the little nastiness they got going just on. Nasty. The voter suppression efforts. Everything. You know, all the little, right. So Kamala can handle it. That's what I know. That's what I'm telling you. Let's look at another question. That's what I'm saying. Let's go down to number 7. I'll read it. Oh, let me share my screen again. Thank you. I like that. Okay. Many weaknesses in disease monitoring capacity at the federal level were identified by Dr. Ruth Berkelman of the CDC, and at the state and local levels by Dr. Michael Osterholm. These included understaffing, hiring freezes, outdated lab equipment and skills, and lack of tracking of disease outbreaks. At the extreme, the situation could be dangerous, as genuine outbreaks, even deaths, were overlooked. Few states really knew what was transpiring in their respective microbial worlds. Question A, were you surprised at how poorly disease was being monitored in the US in the 1990s? B, might this lack of recognition of the microbial threats and disease patterns in our midst help explain why it seems so many people have gone bonkers? C, what viruses, bacteria, or parasites have a known debilitating impact on brain function? Now that was a question for Rick. I was kind of wondering where you was going with that. I'm like, wait a minute, girl. Okay. I was like, Rick could work that one. But yeah, no, I was pretty shocked that the states were not really doing much of anything to kind of track patterns of the types of deaths going on. I mean, they just didn't have the staff to do it. And so if an epidemic was, you know, about to break out, they got no way of knowing. And so the state of the kind of lack of capacity was pretty shocking to me. But my question about, does this explain why so many people have gone bonkers? You know how I'm always trying to figure out, why is the world so crazy? What, you know, is it the food? Is it the drink? Now I got to add to the list. Is it the microbes? A combination. It's a combination of everything. I think the microbes of course, anything and everything and all bacteria and viruses affect you in some way, anything that's ailing in your body. So yeah, naturally it's going to be microbes too that are causing, but the cray was there. It pushed them over.
Yeah.
Yeah, it just pushed people over. It really did.
Yeah.
Or some people that caught it, it might have physically pushed them over too. Because if you've already had underlying illnesses, and if you didn't have underlying illnesses, again, scientists do not know a lot about this pandemic, this virus. It's a virus. Right. They don't know a lot about it. They're not really sure how it's affecting people's bodies. As you heard and know, there are people long haulers.
Yeah.
They were perfectly, far as they knew, in good health. When they got done with when they were over the virus, the initial onslaught of it, they were still considered in good health. And then after suddenly, they figured out they're getting pains in their chest. They go back to the doctor check it out. It's like, it affected your heart. And people got brain fog. One man was in tears. He's an executive. A lot of responsibility. He must be in his late 40s, early 50s. And he was actually in tears. He said, because from nowhere, he had COVID. And he said, from nowhere. And I was as safe as a person could be when I caught COVID. I was not one of the people that didn't feel like I knew it exists. Got COVID. Now I get the place, he said, and all of a sudden I get this brain thing where everything leaves my head. So like the lupus fog I was telling you about. People don't understand unless you get one. When I say everything leaves your head, it's not like you're trying to fish for something and you have a clue. No, it's almost like somebody that's wiped everything out your head, and to the point where you're thinking, what is a thought? That's how bad. He said it, and he's just in tears. And he says it's scary when it happens. It's scary. It lasts about 10, 15 minutes. And when I finally come out of it, you feel like a person that's been in a coma or something and just coming awake. And it's still like everything doesn't come back instantly to you. It's still like that time where you're just still trying to fidgety and figure out what's this and what's that. This is what this man is dealing with.
Yeah, I was listening to a man on a podcast talk about the long COVID giving him paranoid delusions.
That's understandable.
And he was like, I was a perfectly normal guy before this happened. And, all of a sudden he's having these looking out the window and, feeling like the person across the street is watching him. And, he couldn't go out in public without feeling like, everybody was out to get him and all that kind of stuff. So it's, yeah. So it seems that,
I believe that.
SARS-CoV-2 is just, one of the viruses that has some impact
on your brain,
on our brain. Yeah.
That's why I've heard that it wasn't just that one gentleman that I've heard. I happened to see, the program, he was actually talking about it. It was a news, but a news type of, not the evening news. And no, there's a lot of other people having that same problem. And he said it's scary.
So much. Our girl Harriet Washington has a book out on environmental racism that is just looking at all of the toxins in the environment that are having a terrible effect on people's brains. So I mean, you turn on the TV, you turn on the news, it's just one bad scene after another. What did we have? We had the the situation in Atlanta with the killing at the Asian massage parlor. A few days later, the grocery store. You know, I thought about you, Venita, because I know that's your greatest fear is going to the grocery store.
And
but it's a reasonable fear. That's not paranoia.
All right, that's reasonable. And since the pandemic, I've been telling you about how I race through the stores. I have my note either in my head. Most times it's not on paper because I don't touch anything. If they move it, we don't get it. You know I was paranoid about it. You see why I was paranoid?
That's not paranoid. That is a real concern.
And what I tell
you,
the
grocery store, the massage parlor, the movie theater, the school building, the church, you know, anywhere you're going to be around human beings these days, you are really taking your life into your hands. And, you know, and the fact that we can't, even as a country, have a rational discussion about it, that so many people are choosing, or I guess I assume they're choosing, to live in this altered universe. I posted last night, I posted a link to Michael Moore's movie, Bowling for Columbine. Because I watched it again yesterday. And so, you know, so this goes back to 1999. And he was really looking at the fear that white people have of Black people, and how this drives them to feel like they have to build up these arsenals of assault weapons. Totally unfounded, totally irrational. But the kinds of things that they tell each other to keep the irrational fears going, it's just astounding. And it's just so much worse today than it was even in 1999. So I don't know. I don't know how we work our way out of this.
I do believe, again, what's the name that was in the White House for 4 years, made a huge difference on whether people can have rational conversations. Not saying these people weren't there, they were always there. But there's always room for somebody to bend, because, you know, there's teeters, and there's room with intelligent conversation and facts for people to come back over to the side that's rational. If in fact we had a rational person in the White House, and the person before him was Barack, happened to be Barack, it could have been John Doe, that was rational, then I think a lot of things would just go differently. You could have those rational conversations. If it was Barack, then Biden. Or John Doe, that wasn't the other person, and then Biden. You wouldn't have had a lot of things that you're having going on, like let me out, you're intruding on my civil rights. And then you got somebody in the White House saying, let him out. You're intruding on that. That would not have happened. So I think all that stimulation made it more difficult to have, actually impossible from what I'm seeing, with the White House so-called insurrection, which I call terrorist act. It made it impossible. But if in fact you didn't have that going on, I think it would still been a great percentage of those people that was teetering on the line with whatever thoughts they had, that you might be able to convince them that that is not the truth. This is not fact.
Yeah.
But he done taken them off in another place. And again, it's very easy to take people off in another place that really want to escape. To me, I think they just want to escape realities. So in order to escape the reality of life, I'll just go off and talk about, I don't even know the names of the things. What is called? Something non-Q. What's that called?
QAnon.
That. Yes, I don't even know the names of all these some of these things. You know, you wouldn't go off into that area of pedophiles going around raping children, and I mean, you know.
Yeah.
So
Yeah.
that's why I think that everything is so much. It seems like it's so much worse than it is or had to be, because it really didn't. I don't believe it had to be this bad. You're gonna have those believers,
Yeah.
but they'd have stayed in their house and believed it. They'd have stayed around the dining room table.
Right. And they should not be in Congress.
Well, you know what? This is not new either. It's just that they're showing you who they are now. There's always been the racists. You've had Ku Klux Klansmen that are your physicians.
Yeah.
They treat you during the day and put the hoods on at night.
Yeah.
So no, these are people who they were. But again, you had, what's her name? Tell them that no, you ain't got to put no hood on all that stuff now. A new sheriff in town.
Mm-hmm, mm-hmm.
But they're not new. They've always been there. They have always been that. As a matter of fact, I feel kind of grateful in spite of it all. That curtain is pulled back, that mask is pulled down. Because other than that, if everything was still Barack love and happiness, then you wouldn't have seen that. You would have known it was there. Because I mean, come on, it's America. It's there. But you wouldn't have really seen it.
I've seen enough.
Well, and that's the good news that we're not 25 and 35, and I'm as high as I'm gonna go in the numbers anymore. So we won't see a lot more. Well, I don't know. This has happened very quickly, so we could see quite a bit. Actually, I don't want to think about Michelle.
All right. Well, why don't you read question 8?
Excuse me.
What? Can you read question 8?
Sure. Oh, are you there?
Uh-huh.
Oh, it said leave. That's why I thought you were. Yeah, it said leave up there. I was wondering if you were gone.
Can you see my screen, the agenda?
Yes, I do. But leave came up on the left-hand side over here, my left.
Okay. Okay.
Okay, the CDC's efforts to upgrade systems had to garner political approval. In request for funds immediately threw the fate of the disease, surveillance, and preparedness in the hands of politicians. Thus, what began as a scientific concern ended up as fodder for congressional debate at a time when legislators were under public pressure to reduce the huge US national debt. This is a public health crisis. Is his name Foe?
Yeah.
Okay. Foe argued $1 trillion is spent on weapons annually. Of the 14 million kids who died in 1989, 9 million deaths could have been prevented for $2.5 billion. And that's what's spent in the United States annually for cigarette advertising. Oh. A, is it the American public or our politicians who seem not to grasp the threat posed by microbes and consequences of encroaching upon their natural habitats? B, are our priorities as species jacked up? If so, what might we do to increase our chances of understanding the need to include infectious disease potential as matters worthy of our time and resources? C, it seems NGOs are critically important in disease monitoring and are able to do so with fewer nationalistic or cultural barriers. Would the world be better off, in your opinion, if NGOs, instead of WHO, were in charge of global health? Why or why not?
Thank you.
Okay, now.
Yeah, I mean, I just, And so I think it's both the American public and our politicians that don't understand the our relationship to microbes. I might not have seen that so clearly, in terms of what you just said about pulling back the mask. I might not have seen that so clearly had we not just spent the last year that we've spent with people not wanting to wear masks, with people continuing to gather in large events. And why don't we just assume they're not washing their hands much either?
Well,
it's like we're this girls just gotta have fun kind of culture. And even now, with all of these variants on the scene and certain states having a surge in COVID-19, people just want to get back to their lives as if we're not still in the very grips of a deadly threat. I don't get it.
That's what the United States does to people, no matter where they come from. As soon as they set foot on the soil here, whether it was yesterday or 80 years ago, the assumption is automatically that we have the right to do whatever we want, whenever we want. And if anything or anybody, even a pandemic, gets in our way, no, I'm serious, then this is an issue for us. And that's what it is. It's entitlement. Americans feel like they're entitled, or should I say a lot of Americans feel like they're entitled because they've always been entitled. They've always had freedom of movement, freedom of speech, the right to vote, the right to protest against the pandemic. And they're like,
not gonna stop me.
You're not gonna stop me.
Living my life.
That's right. Get back to my wonderful life. And you can always tell for those that have the wonderfulness. The people that were subject to follow the rules that's been set in place so that we can fight this pandemic, I would bet you, and I don't have statistics, again, I'm not a statistician, but just from my life experience, I would probably put my money on they're the people that more people of the have-not group than the haves. Because we're used to restrictions. We're used to having to do what we have to do in order to survive. Mm-hmm. Mm-hmm. I wish I had some statistics. I love statistics. I wish they had some, because I can almost bet my life on it that you will have more of that. And even in the so-called middle class, you will have more of that lower middle class. The middle class for the government, mind you, you're making about $3,500 a year. Mm-hmm. That is right above poverty line, which is probably about $13,000, $12,000. That's what they consider poverty line, poverty around that amount. So anything above that, that's when you start the middle class. Mm-hmm. Did somebody concoct you? There's some kind of crazy went on with that too. So, and of course, you'll have more of that lower middle class, and now the mid-middle class, which used to be the mid-middle class, that's now in the low middle class, right down to the working poor, because that was all ended. So you'll have, so then you go on with the other folks that, the upper middle class, probably the ones, making a couple $100,000 a year. You'll find a lot of those folks more subject to have that resistance because they have more life. Mm-hmm. I may have resistance too.
They're missing out on more.
Yes. And I think, come on, Michelle, we had that yacht. Come on, girl. And we had that yacht in that summer home in south of France. We may not be out there resisting, but we would just be more in a hurry. Mm-hmm. to get back to going to our home in south of France so we can get a chance to sit in all those beautiful cafes that we're accustomed to and going to the beautiful museums. It's not a bad thing. I'm not hating on them.
But that's exactly why I framed this question the way that I did, because it seems to me that we just don't really understand how dangerous and threatening these microbes can be. Not all of them, a whole bunch of them live inside our body or outside our body.
Right.
We need some of them to live, not all of them. But I think they're kind of like an out of sight, out of mind kind of thing for human beings. You can't see them with your naked eye for the most part. So we don't seem to, I guess we're worrying about what's right in front of us, what we can see. And this is just a level too high, too remote, too difficult to get our heads around. Because I think if you understood it like Laurie Garrett understands it, I think if you understood it like Anthony Fauci understands it, I think if you understood it even at the limited level that we understand it from having read this book, then you'd be talking about how can we do everything we can. We don't want to mess with those microbes. We don't want to mess with their habitat. Let them do their thing. We'll do our thing.
That's right.
We'd be trying to figure out, how to coexist. Because there's way more of them than there are of us. We're never going to kill them.
Oh, no.
This whole war language, we're never going to kill them all. We can't even see them.
Something's willful. Somehow, it's not about it has to be willful. Now, even I can say that you just not wouldn't be something that's on the top of your head all the time. Of course, you and I have a healthy respect for microbes and a lot of other stuff because we decided that we want to know something about it. But even given that, even if you didn't want to know anything about it, now would be the time that since you don't know anything about it, that the way I'm made and the way you're made is that we don't know. Here we go.
Right.
So a lot of it has to be willfulness. It's that entitlement. All of us now, I can't keep blaming on other stuff. Now that you do know it's here, now that you do know about microbes, even if you don't know about microbes, you know about this pandemic. Even if you didn't believe that all those people died from it.
Except for the people who say there's no such thing as COVID. The ones who think it's fake news,
But see, then again, mental illness, again, has not been addressed. Has never really been addressed. You and I know that. So we got to put some of those people, I should have been a statistician. I'm telling you. You got to put some of those people aside in the mental illness pile. And I don't mean that to be disrespectful or to make it seem because I'm very serious about mental illness because we all got a touch of it some way or somehow. But let's put them over here. Some of it is just they're mentally ill before the pandemic. People say, there are people that believe in all kinds of stuff that we can't see, and they believe in it. And people aren't dying from it. That's the funny part about it. They will believe in something they can't see, and people aren't dying from it, but something that you can't see that's actually throwing people down by the hundreds of thousands, you out there talking about pandemics don't exist. And even pandemics didn't exist. Okay, some of it's still willfulness. We had epidemics.
Right.
You got your kids vaccinated.
Right.
That's what I'm saying. You telling me, okay, that you didn't get your children vaccinated against polio, rubella, mumps, measles, you name it. So you tell me then all these people didn't get their children vaccinated. Okay, so even if you don't believe in pandemics, you know there were epidemics that were taking people out by the hundreds of thousands. Matter of fact, this is lightweight compared to some of the diseases that we had before we had inoculations that were taking out people and children. We have people living in iron lungs to today. There are people living in iron lungs till today. So it's like a lot of it has to be willfulness. You have willed yourself to believe what you want to believe. Because you can't tell me that. Even if you don't believe in this, you know that there are illnesses that was killing folks. And if we didn't have vaccines, that would still be killing us. And people are still getting polio. It's not as common. They're getting measles, mumps. But now when you get the measles, the school, now they got some stuff in place. Let there be a measles case up in the school, girl, they got that tracing like this. The school do not play. And that's why we're able to control it. Because as soon as one student get the measles, they will shut a school down. They have done it in Connecticut. They shut the whole school down. They have done it. I mean, over the years, it's a normal thing here. They'll shut it down. Have everything fumigated. Those students can't come back to school for the next 10 days. They do all their tracing. Wait to see who's going to break out with what. They got those needles ready. And that's what I've always seen them do here. So it got to be willfulness, Michelle.
Yeah, I agree.
But that's okay, you know. The coming plague, we're happy to say that we willfully know that microbes exist. We willfully know that pandemics exist all over the world. It's not just this one going on at this moment. There are many going on at the same time. And that's why I suggest, I don't know if I do or not, how much time you got to read The Coming Plague, because you will know some stuff.
Yes. Let's take a look at question 12. I'll read it.
Okay.
Most emerging infectious diseases and almost all known pandemics are classified as zoonotic diseases, zoonosis. That is, they involve microbial transmission among animals that ultimately spills over to humans. One Health is defined as a breaking down of public health silos among livestock, domestic animals, wildlife, and human health, and the environment to better address health threats that include infectious diseases. The rate at which novel microbes spill over and spread has risen in step with exponential increases in environmental and land use changes, disruption of wildlife habitats, global travel and trade, and increased human-animal contact. SARS, MERS, and COVID-19 has been driven by expansion of human settlements into wildlife habitats and by the hunting, consuming, and exploitation of wildlife. Coordinated and cooperative action across human, animal, and environmental sectors, One Health, is recognized as an essential strategy to tackle this rising threat. Within the US, public health response to outbreaks of animal origin microbes is hindered by jurisdictional boundaries among the CDC, FDA, US Fish and Wildlife Service, USDA, and US Geological Survey's National Wildlife Health Center, and between these agencies and their state and local counterparts. Coordination among these agencies would speed up identification of microbial threats and mitigation strategies to address them. For example, the US is the biggest importer of wildlife on the planet. with 10 to 20 million individual animals imported legally each year. Multi-sectoral One Health surveillance systems integrated across animal, human, and environmental health can vastly improve early detection, control, and ultimately prevention of future threats. Question A. The above passages are included mainly to give us a familiarity. That passage that I just read came from something that I posted in the group. So anyway, question A, the above passages are included mainly to give us a familiarity with the current concept of multi-sectoral One Health surveillance systems. However, are you surprised by the lack of coordination among these agencies in 2021 around disease detection issues? And question B, do you suspect Laurie Garrett approves or disapproves of the multi-sectoral One Health strategy? Why or why not? So I'm going to say yes. I think Laurie Garrett probably approves. Let me go back up here. That article that I was quoting from includes it's written by a bunch of scientists, but it includes Dr. Michael Osterholm, that has shown up in a lot of places in our reading. And it's an article that was published just recently. Where's the date? In 2021. And so it's promoting this concept of One Health, of human, animal, environment, setting up systems that track potential disease threats in all of those arenas. So yeah, I think that Laurie Garrett would approve of it. And yes, I am just shocked and surprised and disappointed that those agencies have not already been coordinating their activities. So, the thing in the book with the research monkeys, that it tracked wherever the monkeys came. I think they started out in the Philippines, and then whatever airport they had to go through there. Eventually they ended up at JFK, and JFK apparently has the largest animal holding center in the country. And, but the procedures were so lax. Nobody's wearing gloves or masks or anything like that. And eventually the monkeys end up down in Virginia. It's just the contact tracing, from all the airports alone, it is just beyond the beyond. So, and that's something happening in the late 80s. So to be in 2021 and to not see good coordination already in place among all those government agencies around these kinds of things, it's frightening.
Well, to frighten you a little more, because we don't want to be left unfrightened after reading The Coming Plague. A lot of animals now, and they have been, are showing up with COVID. Cats, domestic animals, dogs are all getting COVID. Yes, it's been going on for quite a while, and they're not talking about that. humans are passing their COVID illness onto their pets.
Wow.
And a lot of
Wow.
pets have gotten very sick, and some have died from COVID. They've been tested positive for COVID. The humans are passing them on to their domestic animals. And they just brought that to mind. I just was reading another article a few days back about that. From it's out of Johns Hopkins, actually. The owners are concerned because they didn't know that they can pass on COVID to their cats and dogs, and that's what's happening. I get that one. So
Wow.
if your pet and they want to know now, since people are getting this information, animal lovers, you might not know, or I might not have known because we don't have cats or dogs. We might be more concerned if we did. Now they're finding out they've been tested positive, and the animals are getting really sick from it, and some are even dying because they have COVID. And they're quarantined with their animals. And they're getting it out there now that, people want to know what can we do? Now, did anybody know that? Because that's not new. That's not happening now. And they've been seeing it more and more and more. The cats and dogs are getting COVID.
No, I just had a flash image of a cat or a dog on a ventilator. But in the book with the research monkeys, I think they had detected, I don't remember if it was Ebola or what those monkeys had, but they detected it in 50 monkeys, I think. And there were another 300 monkeys at the Virginia facility. So they euthanized all of the monkeys. Just wiped them out.
Well, see, that's what I'm trying to say. It's always that's what the point I was trying to make is always concerned about the animal passing it on to the human. Which is why we have scientists out there looking for rats and all kinds of rodents and everything all over in the east or whatever.
But I'm saying if people's pets are getting it from the humans, and we can't even figure out good how to treat the humans. My guess is that those pets are going to be in bad shape. Yeah.
And they're going to be in bad shape. And are they passing on to the next human? Which is the question. Did the egg come before the chicken came before the egg? But humans are always so focused on the animals passing it on to us. So are the animals then, could they pass it on to someone else? Before you know you got COVID. Or if you asymptomatic and you don't get sick, but your animal gets sick from you being asymptomatic, but before your animal gets sick, you got some friends over because you don't even know you got COVID. And they petting your dog or cat. Cats come jump up in your lap. So do dogs.
Right.
And that's not, and I haven't heard any research about that. It's just so much is unknown about this pandemic. That much they do know. I'm just looking for further research. Okay, now that we know this, now what? But I can't expect that out of them when you can't find the agencies that were coordinating. And we know why. A lot of times it happens. It's all politics. It's not that each agency or people in the agency don't know that this should happen. They could be they've been trying to make it happen for the last 20 years, 30 years, as far as we know. But because of politics, that when it comes to health, it seems like, in particularly, it's like you might not never get there. Look at the people that died in pandemics or epidemics in other parts of the world that the scientists are there on the ground trying to figure out, about no PPE. They was putting in a piece of wire to a nail trying to get some electricity to get on the phone. Imagine, all the people that are dying or did die because of politics. Well, because of not having the scientists. The scientists were willing to risk their lives. They are some real troopers. They are real troopers. Because you might have been going, you depending on me to go out there in the middle of Zimbabwe to find anything. I'm saying? You will be going, the world will be going, they depending on Venita to do it. Because that's going to happen.
Or me.
Well, I know you ain't going. That's why I even mentioned your name. You be saying, Venita, let me know. No, you wouldn't even do that. You be saying, don't go, let somebody else do it. No, don't go. No, but I'm serious. And, their lives they put in the line constantly, for humanity. And then politics jump in. We read it all the time. And then on top of that, once that scientists or a group of scientists or different administrations with scientists in them from different countries and different areas find what's happening and then try to figure out how they're going to treat it, here comes more politics. Well, you're not getting all that credit. Not just between the scientists, whole nations, governments fighting. I mean, it's just, so that's why that's not there. It's probably not lack of, they don't know that should be done.
Right.
But I'm sure the obstacles in the
right. The obstacle, it's us. It's human beings.
As human beings, it's causing the issue. But anyways, where are we?
Let's
7:20.
Let's talk about cluster 2.
Oh.
So we said we were going to read this book. You have your book, Venita?
Yeah. Let me go get my book.
You don't have to get it.
Okay. I got the book.
Okay, and Rick has it, so we've taken care of that. This is called Debt. This is a very plain, drab kind of cover. I mean, I think they were going,
I didn't think, I thought it was a little inexpensive. I mean, I knew it was going to be a paperback, but it's so paperish. Yeah, I probably did better buying the hardcover, but then who wants to pay $1.5 million?
But I'm talking about this design of having a receipt, and I guess, they're trying to communicate debt. But I'm like, I don't know, it's not really, anyway. The book is called Debt, The First 5,000 Years by David Graeber. And the new and expanded edition is the one we have published in 2014.
Yeah.
And so I wanted to ask you, how would you feel about changing our day to Thursday? Because I'm going to start back up with the Global Black Feminists on Tuesday.
Well, we're not going to start right away anyway. We're going to give ourselves a break, of course.
Yeah.
Yeah, we need a good break. It's spring. Let me check and see. I don't think that would be a problem, but I want to say that right now, but I don't think it'll be a problem.
Okay.
But I'm going to check and make sure because I got a whole schedule of stuff going on here.
Okay.
Yeah. That'd be good. Mm-hmm.
So what I'm assuming it would be okay for Rick because I think he was open to any day from the beginning.
Mm-hmm.
But yeah, I just think for me it would be better to have a day in between the book group.
Well, yeah, if you're doing both of the groups, yeah. It's a lot. That's why, I guess we could discuss these things further when Rick's feeling better.
Yeah, well, I'll reach out. I'll reach out to him about that. But, I think it's more whether or not it's going to work for you.
Yeah.
So what are you feeling like in terms of a break?
Well, after Laurie Garrett, we can break for a couple of months. The weather's getting warm too. There's a lot of things going on. A good break is always good in the warm weather. That's it. I have nothing. There's no more. That's it. Nothing else is coming.
Okay. Okay.
It's actually warm in here. It's actually warm. Are you warm?
I am.
Okay, I thought maybe it's just me. It feels like humid and hot or something.
Yeah. So, all right. Well, let me reach out to Rick, see what he's feeling. See what he's feeling.
When is the Global Black Feminist Reading Circle starting?
April 20th.
Oh.
Yeah.
Mm.
Yeah. So,
That's soon. Well, that's not. We're in March. We're still in March. Okay.
yeah.
The months are going so quick. I can't even keep up with them.
Yeah. Yeah.
And that's right. There's the book. We already chose the book, actually.
Mm-hmm. Mm-hmm. So, all right. Well, I guess that's all I have to talk about. And so yeah, anybody trying to follow us? The Facebook page for Reading for Change. We'll have all of our plans as we make them for when we'll start back up with debt, the first 5,000 years.
That's gonna be interesting.
Already. It looks like pretty fun reading. So
I think it's gonna be interesting. Very. Yeah.
Yeah.
Mm-hmm.
Okay.
All right, Michelle, as usual, it's been a wonderful time.
Oh, I forgot to ask you, did you have any overall thoughts about the book, about the coming plague? I mean, we've kind of been critiquing it, ever since we got out of the AIDS chapter.
Yeah, no, not really. I think we have been critiquing it all along. So it really isn't a lot to say at the end of the book, which has been a interesting but long book. And I think we've just been critiquing along the way.
Yeah.
But I do suggest that folks that don't know, much about or anything about microbes, buckle your seatbelt if you dare, because Laurie Garrett can teach you. No, she can teach you. She can tell you some stuff for real, really. She can tell you some stuff. So I do suggest that people read The Coming Plague.
Yeah.
And it's a lot of book, a lot of information. It'd be good winter reading for sure. Those, and especially in the north, the long winters, great reading, because it will take you from October to March to finish. Because there's so much, and she has a lot of interesting facts in here. I mean, it's just not just the microbes. I mean, she gives you history facts, all kinds of things that I had never heard of, didn't know about, and we're probably not have gotten
the technology,
everything. I mean, it's just not about this micro. Some
people,
maybe,
don't you feel like Michael Osterholm and Carl Johnson?
And yet, it's like they're old friends of ours. And when you mention those names, yes, it just feels like they're old friend of ours, and we know them, and and their personalities and what they stand for and how they move. I mean, this book really does have a lot going on. I mean, it really does have a lot going on. That part I did enjoy, because she gives a face to the scientists. They're not just scientists. She gives when you get done, you know their personality, you know how they look. She described them: tall, lanky, shorter stature, serious, not serious, good sense of humor. So I did appreciate that a lot, because if she didn't do that,
how it all works with the politics. That I mean, if scientists could just do science, that would be wonderful. But that's not the world we're in. No. And so it really helps you understand the whole how politics interfaces with science, and and we get what we get is a motley mess, but we get what we get.
Right. Well, that's why we're where we're at with the pandemic, because politics came into play. If it was strictly science and we were dealing with our facts that we know and dealing with what we don't know and trying to find out more about it, and if it was just that, and just a lot of people wouldn't have to die. Wouldn't have to die. I guarantee you that they would. A lot of folks died that didn't have to die
Right.
because we'd have been so focused, laser focused on what's in front of us. It's all the extra.
Right.
So we really could focus on what we were doing and be able to move quicker, much quicker than we did move to prevent some of the illnesses and deaths.
Yeah. Yeah.
You know,
Definitely.
but politics really did help to kill a lot of folks.
Yeah.
You know, so, but again, we're pretty lucky. We're here this evening, but Coming to Plague, I definitely would suggest that folks read that. And again, it's not just science, because if it's just science for 600 something pages, page 100, we'd have been gone. If she didn't give faces to the scientists and the politicians and all the other things, you could not just read 600 some odd pages of science, unless you were a scientist.
Right, because it's not just science. And
Right.
I agree. I do think it should be widely read.
Yes,
if it has,
yes, definitely.
You know, because it's also you know, our lack of understanding around climate change.
Yes.
And, the impact that human beings have on the environment, and you know what it really means, you know, when we decide to cut down a forest and all that kind of thing. And you know, as much as we don't want to give up our stuff, you know, as much as we don't want to have to change our lifestyle in any way, I'd like to believe that the more we understand about the interconnections, you know, the better, again, back to the better able we are to have rational discussions about the problems facing humanity and to come up with reasonable approaches to making things better.
For sure. Yeah. But I do believe the younger generation, it was a movement, but it really got distracted and pretty much sideswiped by capitalism.
Yeah.
Yes, because when I grew up, when I was in my godparents in Center City, there was always that flower power movement to save the earth, save everything. I remember specifically those movements, and it was consistent. It was all the time. The artists, everyone, the laymen, everyone. They're very conscious about things. So no, what happened was capitalism took hold of people's mind.
Right.
But the same way we learned to, I should say, bow to capitalism, we can unlearn it.
Right.
That's why you got to keep saying it over and over and over again, as you would always say, over and over, repetition, you can unlearn it.
Yeah.
And get back down to the way it was and start having consideration for the forest and stop worrying about some crap stuff. You don't even use the stuff.
Right.
So yeah, I think that's possible. I'm optimistic about that. I really am. Yeah.
Well, let's end on an optimistic note.
All right. I will talk to you soon.
Okay.
Good night.
Have a good night. Good night.